10 tips for effective arthritis pain management. Arthritic pain can be fairly severe, depending on the type of arthritis you have, your activity level, and the amount of inflammation and joint damage you have within the joints. Because of this pain, there are things you need to do in order to manage this particular symptom. Here are 10 tips for effectively managing arthritis pain. 1. Pace yourself. If you have activities to do during the course of your day, try not to do all of these things at the same time. Instead, do one activity at a time, taking plenty of rest periods in between. That way, you can get the most jobs done, with the least amount of pain. 2. Practice meditation. Meditation can be done by anyone. It involves focusing on the breath, while relaxing the muscles for several minutes at a time. You can say a mantra, or practice guided imagery as part of your meditation. Guided imagery involves imagining yourself in a beautiful place, such as a beach, forest, or meadow, and focusing all the senses as though you are actually there. Meditation reduces stress, and therefore reduces the perception of pain. 3. Do stretching exercises. People with arthritis often have stiffness of the joints, especially when waking up in the morning. Before getting out of bed, or when you first get out of bed, take the time to stretch each of your muscle groups, so that the stiffness can be alleviated before you start your day. 4. Take NSAIDs. Non-steroidal anti-inflammatory medications such as aspirin, ibuprofen, or naproxen sodium can not only reduce the pain of arthritis, but also can influence the amount of inflammation within the joints. These medicines are marketed as Motrin, Advil, and Aleve, although the generic forms work just as well. Take them with food, or milk to avoid gastric irritation that comes when you try to take these medications on an empty stomach. 5. Take acetaminophen. Acetaminophen is unique, in that it treats the pain of arthritis, without taking care of the inflammation associated with the condition. It can be taken at the same time as non-steroidal anti-inflammatory medications, so that you get pain relief from two different angles. Acetaminophen can be taken with or without food, as it doesn't result in gastric irritation. 6. Practice yoga. Yoga is one of the best exercises for people with arthritis. It involves making several different poses, while focusing inward and focusing on the breath. Yoga is good for arthritis pain, because it allows you to stretch the muscles, and improves balance so that you have a decreased risk of falling and perhaps breaking a bone. 7. Practice Tai Chi. Tai Chi is an ancient form of martial arts that has been popularized in the Western world, as a way to manage stress, treat illnesses, and decrease pain. It involves doing a routine of graceful movements, with a focus on balance, and on breathing with the exercises. Tai Chi can be done by anyone who can stand up, and improve strength and balance so you can get around better with arthritis and have a decreased chance of falling, potentially averting getting a fracture. 8. Practice Qigong. This is another form of Asian martial arts that is similar to Tai Chi, with the exception that the exercises aren't as strenuous, and you don't have to stand up to do these exercises. Qigong is very easy on the joints, can be done by people with very limited physical abilities, and can be done anywhere. 9. Eat an anti-inflammatory diet. Arthritis pain can be affected by a person's diet. An anti-inflammatory diet is one in which you eat only those foods known to decrease inflammation, and avoid those foods known to increase inflammation. There is no specific anti-inflammatory diet out there, but it is generally considered to be very similar to the Mediterranean diet, which is high in fish, olive oil, fruits, drinking cherry juice, and vegetables. Processed foods are definitely to be avoided on this type of diet, which means you will have to learn how to cook some recipes for your meals. 10. Engage in aerobic exercise. While it may seem exercise would be painful, for those who have arthritis, the opposite is true. When you engage in non-weight-bearing exercises, such as cycling and swimming, you can improve your cardiovascular system, and can strengthen your muscles, which has the effect of reducing your arthritic pain.